Hello, I'm Dr. Fiona Wu. I'm a consultant urologist at Urocare, and I would like to share with everyone on some common urological conditions and how we can better treat and manage them. Because voiding dysfunction is a group of terms used to describe the different kind of voiding problems, so we have to get to the root of the problem and treat accordingly. If the problem lies in the bladder outlet, either the bladder neck, the opening of the bladder itself, or the urinary sphincters, we may need to use medications to relax the sphincter, the bladder neck, or to teach the patient physiotherapy so that they can do it themselves. If the pelvic floor muscles are the issue, the patient definitely has to go to the physiotherapist to learn how to relax the pelvic floor muscle so that they can be better. Some medications can help, but the patient themselves have to do a series of exercises so that they can regulate their voiding cycles back to normal. If the problem lies in the bladder itself, then it gets a bit more complex, because if the patient has underactive bladder, which means that the bladder muscles are a bit weak, it may be a bit difficult to treat because the medications may or may not work as well. But what the patient can do is to try to do bladder retraining so that the whole voiding cycle can be regulated again. And the thing is that underactive bladder, as one ages, is difficult. For example, some of the patients, when they were younger, they have a tendency to hold back their voiding because of either work commitments or when they are in school. So as a result, the bladder tends to over distend, and after that they will have some issues because they may lose a bit of sensation when the bladder is full. It can be overfilled without them knowing, and when they go to the washroom, they may not be able to void to completion, meaning that they have a sensation that they haven't finished passing urine and they need to go again. So this is a very difficult problem to solve. And to start with, I think what the patients can do for themselves is to regulate their whole voiding cycle by practicing. I think this helps them greatly. Otherwise, we have to give them some medication to try to contract the bladder a bit. If they have a lot of urgency symptoms, sometimes we also have to give them medications to relax the bladder. Although this seems contradictory, sometimes it does help them because we have to adjust the medication accordingly. And back to the topic of the sphincter, sometimes we have to give medications to relax it for them. If the situation calls for it, then we may have to do more invasive treatments such as a neurotoxin injection, such as Botox, so that they can relax. But of course, having said that, to inject a neurotoxin into the sphincter may be daunting for the patient, and the fact of the matter is they may have to have repeated injections if necessary. So in all, right, I think we have to get a proper diagnosis before we can help the patient. For men, right, they also have an additional organ called the prostate, which females do not have. Sometimes the prostate may be the one causing the problem unknowingly. It can be enlarged, it can be inflamed, and sometimes just inflammation itself can cause the patient to have voiding issues, which they are unaware of. Of course, we have to treat the prostate if it is necessary for the elderly males more than 50. So I think voiding dysfunction itself, it's a very complex term which is used in different situations, and to isolate the problem is a job of a urologist, and we can do it well with the help from the patient and with the help of modern technology and investigations.